Hey everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I wanted to talk about the treatment of some common dermatological problems that we can accomplish with lasers. And we can often do it much better than medical treatments or other methods available in the general dermatology arena. So when we use a laser, it actually allows us to specifically target certain tissues and certain chromophores in the skin. So we can target pigmentation, we can target vessels, and we can target water with different types of lasers. And of course, we can also heat the skin to induce new collagen production. But when we're talking about the dermatological problems, I'm referring to things like rosacea, like acne, moles, and also warts and skin tags and things of that nature, which we can often more elegantly and more easily remove with lasers than other available methods. So for example, psoriasis, if it is a localized problem affecting a fairly small part of the body and it's a stubborn patch, then we often like to use the V-beam laser. This is a vascular laser, and it's an excellent tool for helping to basically shrink down the little vessels under the skin that are causing the inflammatory response of the psoriasis. Usually the lesion kind of turns a little bit purple right after the treatment, and within a week we can start to see the psoriasis involute. Now, of course, you may need a few treatments for it to reach completion, but once that plaque of psoriasis is gone, it rarely recurs. So that's one really useful treatment option we have for localized psoriasis. Of course, this is not true for patients who have more generalized or larger areas of psoriasis to treat. We can also treat with the same laser, with the V-beam laser. It's an excellent tool for rosacea. Of course, we have some other vascular lasers that are good for that also. But again, the idea is to seal down those little veins and capillaries in the skin to get rid of the redness and the flushing. And it often also helps with the acne rosacea component where you can have some breakouts with it. The other unique tool with the V-beam laser in particular is the treatment of ocular rosacea. So this is rosacea that causes irritation and inflammation in the conjunctiva of the eyelids. And usually that is treated with antibiotics, either taken orally or topically. Some patients don't tolerate those too well, and it is an ongoing thing that you have to continue taking those medications. So with the ocular rosacea treatment with the V-beam laser, we use little eye shields that go into the eye. They're little metal contact lenses, and then the conjunctiva can be exposed, and we can actually pulse right on the conjunctiva with the laser, and it helps to seal down those vessels. And we've seen some really amazing results in ocular rosacea where patients don't need to be on their antibiotic any longer. Similarly, we can treat acne with the V-beam laser, and also we have other lasers in the office such as the Q-switch laser, broadband light, and other technologies such as thermage that help with acne treatments. And then we can also treat warts. Warts respond beautifully to a vascular laser, again sealing down that those vessels that are causing or helping to support the wart in growing. So rather than freezing the wart or trying to curettage it off, we can literally just cause the wart to die off using the vascular laser such as V-beam or the diode, and then usually it just kind of blisters up, looks kind of purple, turns really dark, and then within a week that wart will fall off. Sometimes we need to do it more than once, but it is a lot more successful generally than the liquid nitrogen treatment where it can take more treatments, multiple treatments. We can get much quicker results with the V-beam, often in just a single treatment, especially for those resistant warts. We can also treat skin tags. We can easily take those off. We can remove cherry angiomas, and basically, again, we use our vascular laser. They're very elegant. They cause a little bit of a blanching to the vascular lesions, and the skin tags also kind of blanch and turn grayish, and then within a week they just elegantly fall off and it doesn't cause any scarring. Also, moles that are raised above the skin, we can very nicely treat with lasers. So rather than having those cut out and then leaving a scar either with stitches or even just a flat scar, we can laser them off and we get really nice success. Most moles will respond after just a single treatment. Again, they turn kind of white and then they basically just come off the skin. And it takes about a week, sometimes 2 weeks, depending on the body area we're treating the mole on, and they elegantly come off, and it usually leaves the skin in a much better shape than if we were to cut those moles out. Sometimes the mole will regrow, and then we just retreat it one more time. Usually, again, for most moles, we can get them off in one treatment. Sometimes you need a second treatment. And then we can also treat birthmarks with our different lasers. So whether it's a vascular birthmark like a port wine stain or an angel's kiss or just a vascular lesion on the skin, we can of course get rid of that. We can also treat pigmented birthmarks such as nevus of Oda, which can occur around the eyes, and other pigmented moles anywhere on the body with lasers that target pigmentation. So these are some of the things that we can treat with our lasers. Actually, we can even treat onychomycosis, which is a fungal infection you can get in the nails, and there are lasers to even target that. So these are some easy, simple treatments that we have available in our office that we use to often treat cosmetic concerns on the skin, including all kinds of dermatological issues that can arise.